Hello, I am Commissioner Emma Darnell. Welcome to Mighty Five Conversations. Conversations is a monthly information and communication program focusing on the sustainable community, economically strong, environmentally safe, with liberty and justice for all. Thank you for joining us. I will be back in a moment. The conversation today is entitled, What's Common About Common Ground? A look at the neighborhood health centers. And joining me in the conversation today is Cathryn Van Namen with KPMG LLC. Mrs. Van Namen is a manager in the KPMG LLP's management consulting practice, which focuses primarily on state and local government and the healthcare sectors. Mrs. Van Namen is a graduate of Trinity College in Chicago, Trinity Christian College, where she earned the Bachelor of Science degree in political science. Welcome, Mrs. Van Namen.
Thank you.
It's good to see you again.
And it's great to be here. Thank you so much for the invitation to talk with you.
Thank you for being here with us. You presented to the Board of Commissioners, along with your colleagues, extremely valuable information not too long ago that is going to help us a lot in completing what we call a holistic approach to public health.
Yes.
That's a little different from the traditional public health center, isn't it?
Very, very different.
We're sort of accustomed to public health centers for vaccinations and for passports. But of course, you looked at what we had and what our plans were very closely.
Yes.
Before you began your assessment. Mm-hmm. And maybe we just might start, Ms. Van Namen, with how is this new concept of a public health clinic, how is it a little different from what we probably expect, many of us?
Absolutely. The holistic approach and the multi-purpose centers in the facilities, they're leading practice. Fulton County, as you know, was very proactive in developing the strategy that is common ground and from an integrated approach. A holistic approach really looks at the comprehensive way that we view healthcare today. It's looking at service delivery of not just public health, as you said, just going to get your flu shot or your typical healthcare appointments.
Yes.
But it's looking at it from a bigger perspective. It's looking at it from, what about your behavioral health? What about your housing needs? What about your workforce needs? It's being able to enhance the integration of healthcare and human services across all the programs for our citizens and the clients that we serve.
Is this pretty much saying that an individual's health status is affected not only by maybe personal habits like smoking or diet, but also other types of factors like joblessness?
Absolutely.
Homelessness?
A holistic approach is really looking at it from an integrative perspective. There is a linkage and an interaction and an interdependency on one's life that affects their health, that affects their potential joblessness, which ultimately could lead to homelessness. And looking at it from this integrated or this holistic approach really looks at an individual as a client in a comprehensive manner.
Yes, so that when a mother comes in, an expectant mother comes in for her WIC voucher and allocation, then the interest of the clinic goes beyond just her physical needs, although that prenatal care
Right.
is, like top of the list for most public health clinics.
Right.
But they're looking at, they want more information. I think
Yep.
you all call that an assessment.
Correct.
So it's not just about going into the center and picking up your WIC voucher
Right.
anymore. It's some other things are done at the beginning. Is that it?
Correct. There's a needs assessment, and that's really a conversation that the client has with the practitioner
I see.
to really let them know what's going on in their life. It's educating each other on not just the purpose of why they're getting their voucher, but a little bit more in depth about what's happening, and as a result, there is the likelihood and the possibility to identify additional services that one person or that woman may need in addition to her voucher or to that prenatal check. If she has a child with her, there could just have a conversation about what's going on in the child's life, or if they're not picking up on something as quickly. That practitioner would be able to then look at the child or refer to another service within the building or even outside of the building to continue that person's continuum of care.
And is this the reason for the opening of a workforce development office in a health center?
Absolutely. It's really looking at a person's well-being from all the various interdependencies in one's life. Somebody that perhaps from workforce development, they may be going to have their appointment and they may be talking with somebody and they're down or they're not emotionally
Or they're
upbeat,
sick.
or they could be sick. And that way, that person would be able to have access, the accessibility of additional services to continue their well-being and to really address perhaps other health disparities that one person may be going through.
I've noticed that you've used that word interdependency quite often. Applied to this situation, I believe it may explain why we would locate a job development program at a health center, because we have other centers where the job development program is located all over the county.
Correct.
But I've been asked, why have a job development program at a health center? And I think it gets back to that word interdependency of factors that affect your health.
Correct.
Is that what you mean by that?
Absolutely. There are, whether it's physical or emotional health situations that may arise when someone does not have a job or they're searching for a job, which also goes into housing or perhaps the identification of additional needs that go beyond someone searching for a job or taking a jobs assessment.
Well, that certainly is what we have heard from even the medical field. We've heard from primary care practitioners that in improving the health status of an individual, you cannot confine your inquiry to purely physical matters. So and you use the other word too about well-being, that you really cannot, we can do this, as planners, we can divide the individual into compartments.
Yeah.
We have a housing department, we have a jobs department, but when it comes to a person's health status, you really can't compartmentalize.
Correct.
Is that what you mean by that well-being?
Yes.
So it seems to be rather appropriate then that we would have a library at a health center.
Yes. And Fulton County has done an exceptional job of having a mantra that we call the no wrong door approach. any entrance, any entryway, any access point you
I like
have,
that.
you have into the health or the well-being of one of your clients, you can then gain that access, and you can gain the knowledge to be able to know of additional services that could, again, continue to address your well-being as a citizen.
No wrong door.
No wrong door.
So even if my plan was to go to the Adamsville Center, to the Workforce Development Office, not really thinking about my health,
Right.
that I could receive information even there that could direct me maybe to behavioral health.
Correct.
Where would the needs assessment, by the way, in terms of process, we're not going to get into that too much because folks really not interested in process. We have to deal with it.
Right.
People are interested in impact,
Right.
and that's what we're talking about. But if a person, intended to really get some jobs information, you said there's no wrong door. So that means that even if they went directly to the Workforce Development Center, there's still an opportunity for them
Correct.
to identify factors that could be affecting their health.
Absolutely.
We're going to have to take a break right now, Ms. Van Namen, but we'll be back, and I want you to, respond to that. When will we assess that person who didn't come through the health door? All right. We'll be back in a moment. Stay with us. Ms. Van Namen, we were talking about the individual who goes to the center for a job, not for a WIC voucher. How does that person enter into the stream there of our assessment, and how might they actually leave there with information not only about a job, but about factors that might be affecting their health status?
Great question. There are a number of different entryways that this person could go through. They could be talking with the counselor at the workforce development, and the workforce development counselor could ask them, well, what caused you to be here?
That's it.
And through that open conversation, and that client starting to discuss and open up a little bit, we could start to identify some potential services or some potential happenings in that person's life to be able to create the opportunity to say, have you considered this? Or why don't I get you some information about this?
Yes, that's very good. So that means that even job development staff must be trained
Correct.
to ask the right questions, right?
Correct.
Because if they ask the right questions, they may discover why a person has had some difficulty in working in certain environments. They may find out they have asthma,
Right.
which is very prevalent in this particular area in my district. So it requires special training, doesn't it?
It requires
To do a needs assessment. Well, I guess maybe special may be too heavy. But training is essential. I remember you all indicated that to us
and I
at the
think
board meeting.
I think it's training. I think that it's awareness, and it's educating not just our clients, but educating all of the various
Staff.
service providers and
Yes.
staff
Yes.
within HHS to better equip them to have those conversations.
Very
And
important, isn't it?
very. And like you mentioned, training is key, and it's essential to having those conversations and to opening the doors for the folks that walk in.
You all also indicated to us, because everybody knows what I mean by you all, but it can be, I'll explain it for somebody in the audience who may not. But the company, the corporation, KPMG, also, because we ask you, you didn't ask us, we asked you to tell us how can we make this system work. We knew that just to say we had a one-stop shop, just co-locating
Right.
by itself wouldn't give that client the kind of information. They wouldn't have no wrong door
Right.
unless we really integrated it. And we were very pleased to learn from your findings that we had taken some important steps in that direction. However, you did make some recommendations that we found to be very useful, and it's been very helpful to us that you have worked with the staff to develop a plan
Right.
that's going to make this work. One of the features I noticed that you talked about a lot was how we handle that information. And tell us a little something about that.
Information is key. The ability to share information across services, across facilities, across the locations, that is where the integration and the foundation for providing holistic case management for each client.
That's a very important statement.
Very.
Without the information, you just have 6 departments sitting out there, doing their separate work.
Right. To promote more continuity, it's imperative that we continue to take steps towards that information sharing.
I see.
On a technology platform.
Information sharing.
Correct.
Among the various departments. Yes.
Yes.
Go right ahead.
So there's a number of avenues, and the county has already made great strides towards sharing more of the information. One of the recommendations that we spoke about to the board was this underlying need for a continued development or a continued strategy to have an integrated case management system, which is...
That case management is critical, isn't it?
It is.
And that is, when you say case management, you mean the ability in the interview or in the discussion, conversation with the client,
Right.
having the ability to get the information that you need in order to be of help to that client. That's what do case managers do? That may be an oversimplification.
Case managers really follow the client through, again, the continuum of care. Case managers are the focal point, who are those initial contact points. They have the knowledge of the client. They have a knowledge of the client's needs. There are different...
That's their home.
That's their home.
Yes.
And that case manager is able to refer them to other services based on the different circumstances in one's life. They're able to identify consistencies and just provide that ongoing support. It's the follow-up after if a woman goes to WIC, since we use that example. If she goes to WIC and she's receiving her prenatals and the doctor understands that perhaps through a testing she may be diabetic. So it's referring her to the right doctor, and that case manager is the one that's able to follow up with the same client, whether it's in WIC, whether it's in primary care, whether it's in behavioral health or workforce. It's kind of the glue.
You have to have the follow-up, though, don't you?
You need to follow through on all of the different services in order to change the health outcomes and to change the health disparities in the community.
Without that, we just have a cafeteria of services.
Just a menu of items.
Just a menu of items, yes. Well, I know that the department is moving in that direction and bringing on board trained case managers who can actually follow a client all the way through.
Absolutely.
Because otherwise, it's not holistic. It may all be under one roof. You know, that's convenience.
Right.
And really convenient at the new Adamsville station because the bus is right there. You get right off of Marta and go right in the door. And that's important.
Very.
To have access and convenience. But it's not common ground.
Right.
Unless that case manager is following Mary all the way through.
Right.
And if you want to know about Mary Smith, there is one place, because otherwise Mary might have gone to job development and gotten back on the bus.
Right.
And as far as her health or mental health problems are concerned, nobody even knew.
Right.
You know, so she gets on a job, she's sick, she can't keep it.
Right.
Or
And then-
she's homeless, she's going back to the shelter,
And
you know, and
then she just goes through this system.
yes. So in order for that case manager, though, to do her job, you have to reduce some of this paper.
Correct.
Tell us about that.
Automation is essentially the ability to have real-time information and readily available. So it's being able to access one database and be able to not input one set of information into one system, and then if she goes to a different
That's
service,
another system.
then that's a different system, and then those two systems don't
Never
talk.
meet.
And we maybe pass paper and we maybe don't pass paper. So the whole story isn't passed along either. So one of the benefits of having more automation or more one system is that you can share the information, and it's the same information that you're sharing to everyone where the services are applicable to that client.
And of course, the home base for the information is that case manager.
Correct.
Is that correct?
Yep.
We know that it's extremely expensive to move from manual to these automated systems. We've learned that in criminal justice.
Right.
We spent millions of dollars in an effort to integrate those systems. I'm getting a signal now that we're running out of time, Ms. Van Namen, but it's very important, the recommendations that you've given us about how these departments and their information must be under one system if that client is to benefit.
Right.
Now, if we're just talking about our benefit as, you know, staff people, then I can have my own system and you can have yours. But if we're talking about Mary Smith and dealing with her as an individual,
Right.
body, mind, and spirit, holistically, then I'm going to have some kind of system where my information can be integrated with everybody else's. That's been very, very helpful to us. We really appreciate it so much, members of the board. This kind of information, we ask for this review because we know that with a severe problem we have in this county of health disparities, at some point, you know, the rhetoric must give way to reality. Thank you so much, and we look forward to continuing our association with KPMG as we go through the work plan that we worked out together.
Thank you so much.
I'll be back in a moment with closing thoughts. What's common about common ground? Fulton County is proud to be listed as #1 in the state of Georgia with respect to population and growth. Even during a global recession, Fulton County has been able to avoid employee layoffs and significant reductions in services. However, my friends, with respect to the elimination of health disparities, Fulton County has not been listed #1 by anyone. In a study conducted by the Georgia Department of Community Health in 2008, assessing health outcomes throughout the state, Fulton County was listed as one of the worst counties in the state of Georgia. This means that notwithstanding the effective use of traditional public health strategies, there is a significant difference in this county between the health status of African Americans and others. To put it another way, public health officials have said that if we are to reduce health disparities in this county and improve the health outcomes of all people, irrespective of race, we must take into account not only personal habits, such as diet and exercise. Strategies must also be based upon a holistic approach, taking into account all of the factors, personal, social, economic, and environmental, which continue to affect health status. The integration of services at the county's neighborhood health centers is designed to achieve that objective. Zero tolerance for health disparities. That's all the time we have for today's conversation. We invite you to join us again next time. And until then, stay strong. To learn more about today's conversation, contact me at 404-612-8222. That's 404-612-8222. You can also email me at emma.darnell@fultoncountyga.gov.